Today we will be talking about the 3 kinds of pain. Now, why do you need to know this information? Well, first you need to understand why you hurt before you can heal. Yes? And when you understand these 3 kinds of pain, how different they are and how you treat each one, you're going to have a very clear understanding that what is going on with your body. So, are you ready? Hi, I am Dipti Patel, physical therapist with 20 plus years of experience, therapeutic pain specialist and a yoga teacher. Don't forget to subscribe and click the bell so you get notified when my new video is released. I have so much information that I can't wait to share with you so you embark on your pain-free journey and live fearless, active life. Let's get started, shall we? Let's say you have ankle sprain or a fractured bones or the back strain, right? Your body has an incredible ability to heal. So within the few weeks or months, let's say less than 6 months, any injury you have, the tissues are healed. But the pain is going on. You see that injury happens, the pain is automatically going to be there, but the tissues are healed within a few months. But the pain goes on and on and on. That tells us that the pain problem is different than a tissue problem. Okay? Now let's understand this, that the pain problem is like an iceberg, okay? The tip of the iceberg is where you have joints and the muscles problem. And the bottom of the iceberg is where you have your nerves, your spinal cord, and your brain. Now, these two combined makes the pain problem. Now, remember this. The brain is not only a physical structure, right? It's not only the biological or physical structure. It also has mind. They both are undeniably connected. Yes? Well, I dare you to prove me wrong. Now, mind has experiences, feelings, thoughts, emotions, all that stuff, and that's where things get complicated. So before we used to say the pain is the biomedical approach, that you have a biology and you treat it with the medical things. But now we say the pain is biopsychosocial approach. Bio means your body and your nervous system, your spinal cord, your brain, the whole entire body, physical structure. That's connected to psychological problems a person's going through, and that also connects to what environment, what sociological factors you have, your relationship, your environment, your culture, all that stuff also affects it. Okay? So in order to understand that, let's divide the pain into the 3 different types. So we have 3 types of pain. The first is the nociceptive pain. Second is a neuropathic pain, and third is a nociplastic pain. Let's dive deep into understand each of this one. So in nociceptive pain, the person has usually, let's say, any tissue injuries, ankle sprain, any surgeries, burns, skin tear, fractures, any kind of injuries that causes a pain, that's a nociceptive pain, okay? And how do you say the nociceptive, how do you know the nociceptive pain? So these are the characteristics the nociceptive pain has. It has a proportionate pain. So let's say you have sprained your ankle. The more you put weight on it, the more it hurts. The amount of the ankle sprain you have, the amount of the pain you have. So that's the ratio the nociceptive pain has. It has a very specific aggravating factors and easing factor. In ankle sprain situation, more you put weight on it, more you stand on it with the full weight on it, it hurts worse. If you walk on it with full weight on it, it hurts even worse. If you run on it, it's extremely painful. So it is a very specific aggravating factors and the proportionate pain. Easing factor, the less you move, the less you put weight on it, the easier the pain is. Okay? It has intermittent sharp pain, so every now and then when you do that motion, it gives you a very sharp pain. And at the rest, it has a dull ache and throbbing pain in the beginning, okay? This nociceptive pain will never have a night pain. You will not have any tingling, numbness, burning, shooting, sharp electric pain. So if you have this 4 characteristic, 100 times likely you have a nociceptive pain. Now question becomes, how do you treat this? Well, here is our medical industry does a great job. If you see a doctor or a physical therapist or a chiropractor, anybody in the medical industries, they know how to fix a nociceptive pain. If you just rest, you do the icing, you elevate the area, you just do a tender loving care, nociceptive pain usually calms down within a few weeks or even a month or two. Okay. Now, the next pain is called a neuropathic pain. So, neuropathic pain happens anytime you injure the peripheral nerves. Now, what is peripheral nerves? So, you have a spinal cord, right? Spinal cord branches out all these nerves that comes out of the spinal cord. All those, we have about 400 nerves like that. And anytime those nerves are injured by either getting pinched or getting traction or just the direct cut, or any injuries happen to those nerves, either by disease process like a multiple sclerosis or the radiations or the chemotherapy. Anyway, this causes the neuropathic pain. Okay, I have some example here like a radiculopathy, like a sciatica, or the nerve injuries in the arms, the neuropathies, the any nerve sensitivities or nerve injuries for those chemicals or the disease process. Okay, now how do you know that you have a neuropathic pain? These are the 3 characteristics of the neuropathic pain. The pain is usually in the dermatomal distributions. What that means, the sciatic pain, usually you have it in your buttocks and going down to the back of the leg, maybe back of the calf, maybe your big toe. Yes, sometimes people will say my arm pain is more on the inside and it goes to my pinky fingers. Okay, so it has a very specific distributions. In medical field, when we do the neurodynamic test or whenever we feel the nerve or sciatic nerve is right in your buttocks, when you touch that tender, that fires up. So they have a very specific tender points. And there will be a history of the nerve pathologies that either you will say you had an accident or you had a certain kind of an injuries that will say us that, yep, there is some nerve compromise here and that could be causing this pain. The nerve pain is usually very deep down pain, okay? It could be burning, tingling, numbness, sharp, shooting, electric. These are all signs of the neuropathic pain. Now, if you have all these 3 characteristics, 150 times likely that you have a neuropathic pain. And this is the study done by Clit Smart, and he put together, this is all scientific evidence-based data, that if you have these 3 things, 150 times likely you have a neuropathic pain. Okay, now let's talk about how do you treat this neuropathic pain. Now, before I go deep in here, I want to share this picture on the left-hand side. This is Harriet. Harriet was a housekeeper of an anatomy professor. And when she died, she donated her body to him. And he dissected her entire nervous system, the brain, the spinal cord, and all these 400 nerves. And this was in 1817. So that was about 200 years ago. And this is still on display at the Drexel University in Pennsylvania. So look at this, our beautiful nervous system we have, right? So let's talk about, in order to treat the nerves or in order to keep the nerves happy, you have to do 3 things. Nerve loves these 3 things. The first is a space. So every time that nerve comes out of your spinal cord, they pass it through either the tunnels, the canals, or the muscles, right? And that's what we call the nerve containers. And anytime the nerves get pinched in between the muscles or the tunnels or the canals, they are not happy. That's where the carpal tunnel syndrome comes in, right? So carpal tunnel is like $8 billion industries in the United States. So anytime the nerve gets pinched or compressed, it's not happy. So we have to open that nerve up. And here you don't need to cut open and make the space for the nerves. You can do this by functional mobility exercises, by stretching the muscles, and by opening that area just fine. You don't need to go under the knife in order to get that done. So keep that in mind. So the nerve has to have a space. The second thing is the nerve loves is blood. So let's say if we take out the brain, the spinal cord, and all the nerves and put it in a weight scale, they weigh about 2 to 3% of your body weight, okay? But this nervous system sucks up 25% oxygen from the blood. They are like a blood-sucking vampire. Let's say if you have somebody who pass out and have no pulse, no breath. What do? We do CPR, right? We do CPR right away. Why do we do that? We do that so we can pump the blood to the brain, correct? If we don't do that, the person's gonna die from a brain death. So the blood pumping the oxygen to the nervous system is extremely crucial. Now, how do you pump the blood oxygen to the nervous system? That's a question, right? Well, you have to do cardiovascular exercise on a regular basis. Every single human being should do at least minimum 150 minutes of moderate activities every week. That comes out to be 20 minutes a day or 30 minutes 5 days a week. Now, people say, well, I get into this debate quite a bit with my patients or my clients. They will say, well, I'm pretty active. I'm a nurse, or I'm a construction worker, or, I'm a mailman. I walk so much. Well, here is the thing. When you are at work, first of all, you are stressed. We all have a little bit of stress that we got to get this done. We are focused. So we are not focusing on our health or walking. We are more focusing on what needs to be done. And you stop, you do this, you stop, you do that. So your heart is pumping maybe 70, 80 beats per minute maximum. Okay, if you're a healthy human being, your heart only pumps 70 to 80 minutes when you're walking and doing things around the work or at home. But when you say, okay, I'm going to go for 20 minutes walk, and you really pick up a speed, your heart's going to be pumping 100 to 110 beats per minute if you have a really good speed. And what that does, your heart is pumping faster than normal. So the more blood is coming out with each heartbeat. So the arterial pressure is pretty high, right? And when that pressure is high, the more blood perfuses and comes out at the capillaries, and that's what lubricates your joints, pump those muscles, and pumps those nerves. And those nerves are like, wow, finally I got some blood. And when that nerve gets saturated, they calm down, okay? And you have to do this on a regular basis. Think about your nerves are like the roots of a plant. If you have a plant and you only water them once in 6 months, what's going to happen? It's going to die, right? But if you water them every 2-3 days, it becomes happier, like finally I got water, finally, so that's exactly how you wanna handle your nerves, by pumping oxygen. So give them a space, give them enough blood. And the 150 minutes came from, if you look at American associations, American Heart Association, American Association of Sports Medicine, American Association of Physical Therapy, American Association of Geriatrics, go any big associations, they all recommend 150 minutes of moderate exercises a week. Okay, it's an evidence-based across the board. So I would highly recommend that if you're not doing it, slowly build up your cardiovascular endurance. That's the number one thing you want to do if you want to handle your chronic pain. All right, now that the last in the list is the nerve loves is a movement. Okay, so when we think about the movement, usually we think about the joints and the muscles moves, right? But the nerves also slide and glide. They are like a wet spaghetti. They love to move, and especially if you don't move for a long time, like you are in a car drive and you're sitting still, after about 2 hours or so, you feel like, no, I want to get out and move, because those nerves are not moving enough in your legs, right? So you want to feel like you want to stretch out a little bit. So the nerves loves to move, and a lot of time those nerves move with the specific gliding and sliding exercises, and that's where the neurodynamic comes in. Okay. Another thing, keep in mind with the nerve movement, you cannot go too vigorous on moving the nerves. If you stretch the nerves more than 20% of its original length, you're going to cut off the circulation. You're going to start killing those nerves little by little. So no vigorous activities when it comes, no vigorous stretching when it comes to the nerves. It has to be, there is a method to the madness when it comes to moving the nerves, okay? But in general, these are the three things. If you have a neuropathic pain and you handle these three things, give it space, pump the oxygen to the nerves, and move them, you're going to slowly calm down that neuropathic pain. Okay? Nerves are very sensitive structures, and it needs a tender, loving care. All right, now our third pain, number 3, is nociplastic pain. So what is a nociplastic pain? Quite a few times everything hurts, these people will have not a one area, they have a pain pretty generalized, their hip hurts or their back hurts or their neck hurts, so pretty much whole body feels achy. Pain is past the healing time. It's longer than 6 months. So anytime you have any pain is longer than 6 months, most likely you have a nociplastic pain. You have tried multiple treatments and nothing has worked. You tried pain medications, different kinds of pain medications, injections, surgery, physical therapy, chiropractor, and nothing has worked. You have a high intensity of the pain. So the pain is usually, when I ask my patients sometimes, they say, well, how much is your pain on average from 0 to 10? And they would say, well, it's 16. Yes, and I totally agree. The pain feels extremely intense in the nociplastic pain. They have summations and latency. What that means, that it does not hurt when you're working or you're doing things, but it hurts later, maybe an hour or two later, or maybe next day, or maybe at that night. The lack of stimulus and response consistency. What it means, sometimes you bend forward and it hurts, and sometimes you raise your arm up and it hurts, and sometimes it doesn't. So it does not have a specific pattern. Sometimes you poke, it hurts, and sometimes you poke and it doesn't hurt. So it does not have those specific aggravating or easing factors. This pain is cyclical and seasonal. What that means, that if you have a death anniversary of your loved ones, or a divorce anniversaries, or your accident anniversaries coming up, that pain is very severe at those times. The pain has traumatic, if people had gone to any past traumas, 30% of those populations can have a nociplastic pain. There is an association that it's a predisposing factor for the nociplastic pain. It has a poor response to the treatment. So sometimes you go to a physical therapist and you try something and it worked great, and you become so hopeful, and you go again and tell that therapist, hey, whatever you did last time, can you do that again? And it made you worse. So it does not have any specific, that this thing really works. Now, miracle cures are possible in here. So if you will say somebody that, you know what, I changed into a vegan diet and boom, my pain was gone. Or I started exercising and boom, my pain was gone. Or they get out of the toxic relationship and get divorced and their pain is gone. Or they move to a different town and different areas, totally different state, and their pain is gone. So the miracle cures are possible, but this usually happens to the people who are at the end of the rope on their pain. They have gone through so much and they make this big drastic change and boom, they see the great results. So this is a nociplastic pain. Make sense? Now, what are the characteristics of nociplastic pain? I know I went through a lot of things just to explain in details. So if you have this 4 characteristics, 486 times likely that you have a nociplastic pain. This is Keith Smart's cluster of formulas. So first is you have disproportionate pain, means sometimes you do this, it hurts, and sometimes it doesn't hurt. It just does not have a very specific pattern to the pain. It has a disproportionate, that's if this thing you do, it hurts, and this doesn't hurt. It does not have a specific easing factors and aggravating factors, okay? No pattern to it at all. Disproportionate pain means the pain is extremely severe at times, and sometimes you don't have pain at all. So the pain comes in the waves and you don't know what triggers the pain. That's a disproportionate pain. It has a diffuse palpation tenderness. So if you find an area and you poke on it, it hurts one time, and then the 2-3 days later you hurt in that area and it doesn't hurt. It will, or maybe a whole entire area is sore. If you touch in any part of that area, it's extremely tender, okay? This people will have a lot of psychosocial issues, either a lot of stress in their life, either they're single moms or too much stress at work. It has a lot of psychological factors, or they are living in a toxic relationship and stuff like that, okay? So if you find you are in this 4 different characteristic, 486 times likely it's a nociplastic pain, okay? Now, in nociplastic pain, there are actual physical, means biological, and structural changes happens in the nerves, spinal cord, and brain, okay? This nociplastic pain does not mean it's all in your head. And this is where a lot of people get in stigma, that this pain will not show up if you do an MRI or a CT scan. The structural and physical changes does not show up in the scans, okay? It does not show up in the lab results. So this is where the doctors will look at the scans or look at the lab results and says, I cannot find anything wrong with you. And sometimes they label the patients that it's all in your head, okay? But be assured that there are actual structural and physical changes that happens, and that shows into a functional MRIs or in the studies done in the research lab. But these studies are done in a very depth, and they are not available in the clinical trials, means in the hospitals or in the clinical settings. This changes what you see in the spinal cord and brain and the nerves are called sensitization, okay? Your nervous system is sensitive or maybe hypersensitive. If you see the changes in the nerves, it's called peripheral sensitization, and if you see it in the spinal cord and the brain, it's called central sensitization. So you might come across some of this terminology if you follow me or if you follow anybody who talks about the chronic pain. So that's what those terminology means. Now let's understand this. What is a nociplastic? Plastic means molded, right? Anything can get easily molded. Plastic is easily molded. You just heat it up a little bit and you can shape up the way you want to shape it. So that's where the plastic comes from. Noci comes from the pain. So the pain can be molded, and it molds the nerves and the spinal cord and the brain, and that's where this nociplastic comes from. Now remember this. Let's say you start playing a piano and you practice for 3-4 years. You get better, right? You do roller skating, golf, tennis, any sports you play on a consistent basis for a long time, you get better and better and better at that. If you read books, you do puzzles, you play chess, anything you do intellectually, that makes you smarter, right? So remember this, whenever the nerves that wire together, they fire together. So your nervous system makes these changes. That's how you process these things faster and faster and better, right? So this is a Hebbian theory. It happens because the nerves that wire together, they fire together. And that thing applies to your pain system as well. The longer the pain system fires, the stronger it gets. Okay, and that's where the nociplastic pain comes from. So the longer the pain you have, the stronger the pain system you have. So let's say you have a pain for 2 years and somebody has pain for 20 years. Who's going to have a stronger pain system? The one with the 2 years or one with the 20 years? The one with the 20 years, right? The person who had the longer the pain, the more the changes they're going to have in the nerves, spinal cord, and the brain. And this changes, some of the changes, not all of them, but most of the changes are reversible with the right kind of training, okay? We have to train the nervous system little by little by little to calm down and bring their sensitivity down. And this is where the comprehensive program comes in. This is where no pain medications, no surgeries, or no procedures, or no physical therapy is going to come in. This requires a deep down approach to train the system little by little by little by little, and it's going to take time. So if somebody offers you a magic bullet or a magic pill or a magic treatments, it does not work. This requires a deep down training. It doesn't, if you do on a consistent basis, it will not take you years to reverse this. If you really integrate and really get into the training, this can be done in a short amount of time. Okay, so don't become hopeless that, oh my gosh, I don't want to go to something for 2-3 years of training. But if you do it on a consistent basis and you really prioritize this, it can be done in a short amount of time. So summarizing it, we discussed 3 kinds of pain. The nociceptive pain. So first, whenever we see a patient, or you can see that which bucket you go in. Do you have a nociceptive pain, or is it a peripheral neuropathic pain, or is it nociplastic pain, right? And then see which buckets you go in. Well, majority of the time, if I have a patient who has a pain longer than 6 months, they're going to have a combination of these 3 pains. It's not usually one or the other. It's a combination. And quite a few times, 40% or more of the time, patient has all these 3 kinds of pain present at the same time, okay, in a different proportion. So, but they have the many times that all three pain can be present at the same time. Okay, so first you understand what kind of pain you have, and then find out, well, what will be the best solution of the pain. So I do offer a course that first we go into the deep dive into finding out what is the cause of the pain, and really make a portfolio of where do we need to start and where we need to target in order to start peeling this layer of onions to get to the deep down pain, and then start treating one by one. But stay tuned, it's coming soon, and there will be a link in the descriptions below if you wanna sign up for the course. Again, if you have any questions, any concerns, please feel free to ask them in the comment below. I'm looking forward to help. My main goal with this to make a change in the humanity and get you out of this pain cycle, so you can start living your life with the full confidence, fearlessly, and enjoy the active life. Enjoy the life. Get your life back. All right, my friend. We'll see you again soon. Thank you so much for watching.